audible to you people? A very good morning to all of you. Give me a thumbs up in the chat box if I'm clearly visible, audible to you people. Can we start ahead? Okay. Okay. Thanks for confirmation. So I welcome you all for today's session. I am Dr. Priyanka Sachdev here, and today I am here to start my IBQ Marathon. Today I am going to discuss 100 IBQs. Today I'm having a total count of 100 and I will finish them all. So I'm going to discuss 100 IBQs in 3 hours. So today all IBQs are from pathology. So I have divided all the IBQs in 3 headings. First I will discuss the IBQs of hematology. So from 100 I'm having nearly 35 to 40 IBQs from hematology only. I'm having 10 to 15 IBQs from general pathology and rest of the IBQs from systemic pathology. In systemic pathology also, I have covered 8 systems: CNS, CVS, RESP, MGT, FGT, breast, bones. We have all the systems. One by one, I will start IBQs of each system and launch the polls. I will be a little bit faster. You have to read the question. You have to look at the image. You will have only 15 seconds to mark the correct answer, to analyze the correct answer. And after that, we will have only 1 minute discussion about that image. I'm not going to give you the detail of the complete topic, only related to that image, because it is a marathon. So we have to be fast enough to complete 100 images. If I give the detail of all the images now, then I will not be able to cover in 3 hours. But I have to cover 100 images in 3 hours. So without wasting any further time, I am moving on it. So I will start first with IBQs of hematology. So I am having nearly 35 to 40 MCQs from hematology. After that, I will move on systemic pathology, and in the end, I will move on general pathology. So I'm starting with hematology. So here is the first question in front of you. You have to be fast enough, huh? So image shows the presence of. Can you see the image? Do you want me to zoom out? Can you see the image? There is an arrow in the image. So that arrow is marking what? Is it marking Howell Jolly? Is it marking Hans body? Is it marking Cabot ring? Is it marking Pappenheimer bodies? Now the inclusions in the RBCs, all these 4 are inclusions in the RBCs. Inclusions in the RBCs are most important for IBQs. So most of you are right. The correct answer here is A. It is a Howell Jolly body. Khushi, Manjusha and Sweetie are first to answer it correctly. We can see Howell Jolly body is present. They are present nearly anywhere in the RBC. It is not necessarily they are present at the periphery or they are present at the center. They can be present at the periphery. They can be present at the center also. And these are Howell Jolly bodies. What are Howell Jolly bodies actually? What are Howell Jolly bodies? Question is more specific if some history is given. Patient undergone splenectomy. तो answer confirm हो जाएगा. It is not Cabot ring. Cabot ring is in the form of 8 ring. It is not Pappenheimer body. It is always at the periphery. Pappenheimer body is always at the periphery. Hans body is also a body, but it doesn't look like this. I will show you Hans body diagram also. So here it is Howell Jolly body. This is the lather board in front of you. Just a second. This is Howell Jolly body. What is Howell Jolly body? Yes, Amranvi, you are right. Howell Jolly body are the remnants of the nucleus of the RBC, that is DNA remnants that are normally removed by the spleen. But the person who do not have spleen, or though they have spleen, but the function of the spleen is not there. In both of these scenarios, spleen is not functioning. Either the spleen is absent or present, but not doing its function, like in sickle cell anemia. In both these scenarios, spleen is not doing its function. So spleen will not remove. When RBCs are formed from the bone marrow, they are formed from the precursors known as normoblasts. So this is hematopoietic stem cell. This is early normoblast, intermediate normoblast, late normoblast. Ultimately, RBC is formed and it will come in the blood. So the precursors of the RBCs are nucleated, and intermediate normoblast state nucleus is extruded, and the remnants of the nucleus are present. These are the remnants of the nucleus. Normally, these are removed from the RBC by spleen, and these remnants are known as Howell Jolly body. These are DNA remnants or nucleus remnants present in RBC, especially seen in patients who undergo splenectomy. Give me a thumbs up. That was about Howell Jolly body. I am coming next question. This is the next question in front of you. Be fast. Look at the image. Identify the cell. What it is? The arrow cell. Have you seen the arrow here? Can you see the arrow here? It is a binucleated cell, looking like an owl eye, ullu ki aankh. So it is a binucleated cell. So first of all, it is a large cell. I can see the size. It is a binucleated cell. I can see 2 nucleus. Inside each nucleus, I can see nucleoli, prominent nucleoli inside each nucleus. So inside each nucleus, there is prominent nucleoli. So all these things giving a owl eye appearance. So most of you are right. The correct answer here is a RS cell. It is RS cell. So Dr. Gaurav, Shatanik and Khushi are first to answer it correctly. And the correct answer here is RS cell. RS cells are seen in Hodgkin's lymphoma. Yes, it is not orphan eye nuclei. Orphan eye nuclei is seen in papillary carcinoma of thyroid, where the nucleus is vesicular, they are anti-promin side. Here I cannot see like this. Owl eye inclusions are seen in cytomegalovirus. So it is not a virus inclusion bodies. Russell bodies are seen in plasmacytoma. It is not that also. I will show you a diagram of Russell. I will show you the diagram of other three also. Don't worry. Here the answer is, the answer is RS cell. It is looking like a binucleated cell. It is looking like a binucleated cell with a prominent nucleoli giving an owl eye appearance. Now, Hodgkin's lymphoma are of 5 types we know. I will not give you the complete detail. The main 4 types are nodular sclerosis, mixed cellularity, lymphocyte rich, lymphocyte depleted, and lymphocyte predominant. These are the 5 main types of Hodgkin's lymphoma. All of them have RS cell, but different type of RS cell. The nodular sclerosis have lacunar type of RS cell. Mixed cellularity and lymphocyte rich, both of them have classical type of RS cell. Lymphocyte predominant have pleomorphic type of RS cell, and lymphocyte predominant have popcorn type of RS cell. You should know the various types of RS cell. Here in the diagram, you can see the 4 types of RS cell. This is popcorn shape, popcorn type. Can you see the shape of the RS cell is popcorn? Here it is owl eye, which is our question. Owl eye, binucleated cell. Can you see this is the cytoplasm? These are the 2 nucleus. Inside the nucleus, this is a nucleoli. Owl eye, and around it there is a clear lacuna. There is a clear space around it. That is lacunar. This one is owl eye, classical, and this one is pleomorphic. So these are the 4 types of RS cell. This time question is on. This is classical one. This is classical one. Can you see this is the cell? These are the 2 nucleus of the cell. Inside each nucleus, this is the nucleoli. This is typically classical RS cell. Maybe next time question can come. Question can come on popcorn type. Question can come on lacunar type. So you should know all of them. There are 4 types of RS cell. The image of all 4 is in front of you. Give me a thumbs up. Give me a thumbs up. Coming on the next question. Tricky one, but good one. Very, very, very important. What is the diagnosis? Which cell is it? Look at the arrow. There is an arrow in the image. In all the images, there is an arrow. Please concentrate on that arrow before giving your answer. Something is marked to give you a clue. Is it a lymphoblast? Is it a myeloblast? Is it a megakaryoblast or is it a normoblast? What is it? Most of you are right. Karthik, Manjusha, and Lucifer are first to answer it correctly. So the correct answer here, it is a myeloblast. Correct answer here is B. Why it is a myeloblast? It is not megakaryoblast. Megakaryoblast are multinucleated. All of them have single nucleus only. It is not normoblast because the size of the cells is much larger than the normoblast. You know, normoblasts are of 3 types: early, intermediate, and late. And normoblasts are the precursors of RBC. These are not looking like precursors of RBCs. These are the precursors of WBCs. Now, WBC precursors, you know how many types of WBCs are there? I will come on the question again, don't worry. There are 2 types of WBCs, granulocytes, agranulocytes. Granulocytes are of 3 types: neutrophil, eosinophil, basophil. Agranulocytes are of 2 types: monocyte and lymphocyte. Out of them, if you leave lymphocyte, lymphocyte is formed from lymphoblast. That is the stem cell of lymphocyte, lymphoblast, and rest all of them are formed by myeloblast. So there are 2 types of blast in the bone marrow. Can you see in the bone marrow? Just a second. Can you see in the bone marrow? This is a myeloblast. This is a myeloblast forming neutrophil. Can you see it is forming neutrophil? And this is a lymphoblast. It is forming lymphocyte. You will see, ma'am, how we will identify in the image whether it is a myeloblast or whether it is a lymphoblast. Both of them are looking same. No, they are not same. If you zoom out the image, you will see the difference. Now see, there are 4 types of leukemias now: myeloid, CML, AML, and lymphoid, ALL and CLL. In myeloid leukemia, patient will have abundant of myeloblast in the blood. And in lymphoid leukemia, patients will have abundant of lymphoblast in the blood. So which blast is present in the blood, depending on that, we characterize the type of leukemia. So whether it is lymphoblast in the blood, which is from lymphoid series, or whether it is myeloblast in the blood, which is from myeloid series. So looking at the cell, these are the 2 blasts in front of you. See the image, very, very important. Myeloblast, lymphoblast. See, myeloblast is little bit larger, lymphoblast is little bit smaller. You will see, ma'am, ये तो comparison जब दोनों होंगे तभी होगा. Otherwise, we cannot compare it. Okay. See, cytoplasm is really more in myeloblast and it is very, very scanty in lymphoblast. Iron rod. The main difference is iron rod. Iron rod. Can you see in the cytoplasm there is a rod-shaped structure here? This rod-shaped structure is known as iron rod. It is present in myeloblast. It is absent in lymphoblast. See the cytoplasm here in lymphoblast. No iron rod is present. So that is the hallmark feature. Give me a thumbs up. See the nucleus. Inside the nucleus, see the nucleoli. There are 4 nucleoli. There are multiple nucleoli. 1 to 4 nucleoli are present. Multiple nucleoli. And here nucleoli are indistinct. So that is the differences. Give me a thumbs up. Now see your question and tell me the correct answer. By arrow, what is marked? Let me zoom it out. By arrow, what is marked? Author is marking, examiner is marking something with the arrow. With the arrow, he is marking some rod-like structure in the cytoplasm. So you can find some rod-like structure in the cytoplasm of all these cells. I can find these rod-like structures in the cytoplasm of all these cells. What are these structures? These structures are iron rods. These structures are iron rods, and iron rods are typically seen in myeloblast. They are not present in lymphoblast. If the diagram is showing iron rods in the cytoplasm, it has to be myeloblast. It is a very, very, very important MCQ. Please learn it. So iron rods are present. Should I proceed? Should I proceed? Okay. So let me come on the next question. Next question is not the MCQ. You can see here also. Beautiful diagram. Lymphoblast, myeloblast. Please see the iron rods in the myeloblast. Please see. Please see, and please see the size, please see the color of the cytoplasm, please see the shape of them, nucleoli in each of them. See the differences. See the differences between the two. See the differences between the two. Everyone give me a thumbs up. No, this is not an MCQ. There are not 4 options. Straightforward, which type of leukemia it is. So read the question and tell me which type of, there are 4 types of leukemia, no? CLL, CML, AML, ALL. So which type of leukemia it is? I will zoom the image for you. Something is marked with arrow again. Something is marked with arrow again here. Something is marked. Just give me a 1 second. Okay, so I will show you the image separately to see what it is. Do you want me to zoom it out? Which type of leukemia it is? So can you see something is marked with the arrow inside the cell? This is a blast cell. Something is marked. So something is marked. Just now I taught you what it is. Something is there in the cytoplasm. Some rod-like structures are there in the cytoplasm. Who will give me the answer? So Karthik, Lucifer, Savita, Dr. Gaurav, you all are right. Very good. It is AML. It is a myeloblast. It is a myeloblast or lymphoblast. You will see, ma'am, it is myeloblast because it contains iron rod in it. It has to be myeloblast. Just now you taught us. Okay. Agreed, it is myeloblast. Now for myeloblast, there are two leukemias now. So it can be AML. It can be CML because it is having myeloblast. It is not lymphoblast. Typically, iron rods are shown in the diagram. Can you see here also iron rod is there, here also, here also, here also. Zoom it out and see multiple iron rods. You can see multiple iron rods. So it is myeloblast. Okay. So myeloblast, why it is not CML? It is AML only. Why? Because in CML, along with myeloblast, other cells are also present. That is promyelocyte, myelocyte, metamyelocyte, and band form. We find all precursors in the blood. But in AML, we find only myeloblast. Other precursors of neutrophil are not present. So here in the image, I can see all the cells are myeloblast. This one, this one, this one, this one, this one. Only myeloblasts are there. It is not promyelocyte, myelocyte, metamyelocyte, band form, everything is present. No, it is not like this. So the answer is typically AML. You can read the question will also give you the clue. A 41-year-old male. So age is always a clue in leukemia. There are 4 leukemias. You should know most common age presentation in each of them. AML occurs in adults or middle-aged. ALL occurs in children. ALL occurs in children, 3 to 5 years children. So it is 41 year. It is suiting with AML. Patient is having fatigue because patient is having anemia. Patient develops cutaneous fatigue because of the bleeding, because of thrombocytopenia. Hemoglobin is less because of anemia. Platelet is also less. And WBC count is more. WBC count is 1,68,000. And this is the peripheral smear. So this is a typical presentation of AML. Explain the findings. Now in the bone marrow, all 3 things are formed from the hematopoietic stem cell. This is a hematopoietic stem cell. It forms RBC also, WBC also, platelet also. Now some mutations are occurring in the myeloblast. So only WBCs are formed, RBC and platelet are not formed. So patient have anemia, that's why fatigue. Patient have thrombocytopenia, that's why have fatigue and bleeding, and all the WBCs are which are formed, they are increased in number, but all of them are abnormal. So patient have infections also. So that is the thing. What is the prognosis? What is the prognosis of AML? There are many prognostic criteria, but overall relapse are common. Prognosis is not very good. So because of presence of IO-RODs, the diagnosis is AML. So coming on the next question, again, this is the next question. Identify which leukemia it is. Which leukemia it is. Look at the smear and identify which leukemia it is. So I will show you the smear separately. See the smear separately. Try to find out the different cells in it. So some arrows are there to show you, to help you in the diagnosis. Can you see this arrow? So this arrow is the eosinophil, I guess. Can you see the red color granules inside? It is the eosinophil. Can you see this arrow? This arrow, it is a basophil. It is a promyelocyte, I'm sorry. It is not a basophil. Here it is a basophil. So eosinophils are present, basophils are present, and various. Can you see this one is a basophil, the black granules. So eosinophil is there, basophil is there. This is a band form. This is a band form. This is a lymphocyte. This is a lymphocyte. You can see this is a promyelocyte. This is myelocyte. This is metamyelocyte. So in the smear, you are looking a variety of cells. Along with blast, you are looking variety of cells. So yes, the diagnosis is straightforward. It is CML. You all are right. The diagnosis is CML. So compare it with the previous smear. In the previous smear, all the cells were myeloblast, having IO-ROD in them. Here, along with myeloblast, few cells are myeloblast only also. Maybe ikka-dukka cells are myeloblast also. But apart from it, we get promyelocyte, myelocyte, metamyelocyte, and band forms. You know how band forms are looking? This one is a band form. It is a band form is like this. This is the nucleus of a band form. So band forms are present. Along with it, eosinophils are present, basophils are present. So it is a typical CML presentation. So again, read the question. 45-year-old male. So age is matching. Age for CML is middle-aged only. Hemoglobin is less. Patient is anemic. Platelet is less. Patient is thrombocytopenic. So ये दोनों चीजें तो पिछले जैसे ही हैं. And WBC count is more. It is 250,000. So in the last question also, RBC was less, hemoglobin was less, platelet was less, and WBC was more. In this question also, this is the same scenario. So clinical presentation of both the patients is exactly same. Age is also both the patients is exactly same. So if you look at the question, it is almost similar. History is almost similar. The only difference is the smear. Only difference is the smear. The last patient was having a different smear. This patient is having a different smear. Give me a thumbs up. Give me a thumbs up. So the diagnosis is CML. What is the abnormality in CML? Yes, 922. You all are right. Either you say 922 or you say ABL BCR. You know that what it is. So on chromosome 9, ABL is present. On chromosome 22, BCR is present. So there is exchange. Because of exchange, 9 will give its ABL to 22. So on 22, BCR was already present. ABL B mil jayega. So ABL BCR fusion is formed on 22. And 22 is known as Philadelphia chromosome. And what is the drug given here? What is the selective drug? Treatment name one drug. Selective drug. Selective one, target therapy for CML. Target therapy for CML. Yes, who will tell me one name of drug? I want to hear that name from you. What is the name of target therapy for CML? One name. It is imatinib. Imatinib. You can't afford to miss it. It is imatinib. It is imatinib. No, it is not Alta and arsenic. Shashank, you are telling me the treatment of AML M3. It is a treatment of AML M3, that is ATRA. Here it is imatinib. It is imatinib. So imatinib is the drug of choice for CML. It is a targeted therapy. It will inhibit this fusion gene ka protein. जो fusion gene ABL BCR बनाए. Give me a thumbs up. Yes, it is a tyrosine kinase inhibitor. Okay. Jan, give me a thumbs up. Everyone give me a thumbs up. So that was the second question on leukemia. The first question I have shown you AML कैसा दिखता है. This question I have shown you CML पे question कैसा आएगा. Question is same. There is no change in question. Only image is different. So coming on the next question. The next question is this. See the options. See the options and read the question. A 70. Look at the age. An old man with painless cervical lymphoadenopathy. So lymph nodes are enlarged. Cervical lymph nodes are enlarged, and it is painless. With progressive pallor, means patient have anemia also, and bleeding, pateki. So bleeding and anemia with lymphoadenopathy, the triad with an old age. So what are the clues in the question? Patient is old, number one. Number two, patient is having lymphoadenopathy, which is painless. Along with it, patient is having anemia. Patient is having thrombocytopenia. So look, and peripheral smear is shown to you. In the peripheral smear, some cells are marked. Can you see some cells are marked? Yes. What are these cells? Let me zoom it out and show you what are these cells. Okay. I don't have image separately, so I will zoom here only. So can you see some cells are marked? What are these cells? I am seeing these cells. These are the cells. These are the cells. Okay. What are these cells? Who will tell me name of these cells? Name of these cells. These one. These are. Yes, you are right. Shatanik, you are right. These are smudge cells, also known as basket cells. Smudge or basket cells are actually mature lymphocytes which are very fragile. So when I make smear, when during making a smear, this is a slide. I will take a drop of blood here and make a smear with the help of a slider. With the help of a slider. So whenever I am using a slider, the cells inside it are very fragile and they will form the basket cells or smudge cells. So it is a typical feature of CLL. CLL means this typical smudge cells are present because of fragility. Their margins become crinated. Can you see? These are lymphocytes whose margins are like this. These are known as smudge cells or basket cells. The answer here is CLL. Give me a thumbs up. So that is smudge or basket. Can you see the cells here? The smudge or basket cells. So it is typically. So here also patient presents with anemia and thrombocytopenia. So from the past 3 questions, clinical scenario is same. यहाँ पे एक extra चीज है painless lymphoadenopathy, which is typical for CLL, not of other leukemia. So out of the 4 leukemias, CLL presents with painless lymphoadenopathy. Anemia presents in all leukemia. Thrombocytopenia presents in all leukemia. Give me a thumbs up. Give me a thumbs up. But see, the clinical presentation is different for each of them. Everyone give me a thumbs up. So the answer here is CLL because it is showing smudge cells or basket cells. Smudge and basket cells are the nuclear remnants of the lymphocytes which are damaged by physical shear stress while making the slide during spreading it. Give me a thumbs up. And typical clinical presentation favors CLL also. So you have to read the question also, look at the image and correlate the two. So questions में से clues लेना मत भूलो. Never forget to take clues from the question. So there are 4 clues: old age, lymphoadenopathy, anemia, and thrombocytopenia. And along with this image, it is typical CLL, nothing else. Give me a thumbs up. Give me a thumbs up. So this is the next question in front of you. See the question. I will show you the image separately also. First, we will read the question, take the clues from the question. Now there is a child, a 9-year-old child is there. See the age. Age is always a clue. So 9-year-old child. Fatigue means anemia. Epistaxis means thrombocytopenia. Easy bruisability is thrombocytopenia. So again, same history, but age is different this time. So patient is having anemia, patient is having thrombocytopenia. Anemia के लिए वो pallor, fatigue, lethargy ये सब terms use करेंगे in your exam. For thrombocytopenia, they will use the terms bleeding, epistaxis, fatigue, bruisability. So these are the terms indicating thrombocytopenia. So whatever terminology used in the question, you should know the meaning of it, depth of it. So a patient is anemic, patient is thrombocytopenic, and patient is a child. Patient is a child, the age is 9 years. Till now, these are the 3 clues. Let me go ahead. Patient is having bone pain. Patient is having splenomegaly and lymphoadenopathy. So patient's spleen is enlarged, lymph nodes are enlarged, and bone pain are there. So organ involvement is also there. So peripheral smear is shown to you. So I will zoom out the image and ask you what type of leukemia it is. So what is the type of leukemia shown here? Now see the arrow. It is showing blast. All of them are blast. Initially, I taught you the 2 type of blast. See, the cytoplasm is very scanty in all of them. All of them are same looking. All of them are blast. All of them have scanty cytoplasm. There is no granules or iron rod. There is no granules or no iron rod in the blast. So these blasts are lymphoblasts. That's fine. Because it is a child, the diagnosis is ALL. So it is a typical case of ALL. Give me a thumbs up. So it is a typical case of ALL. The diagnosis is ALL. Have you got it? Now how you will explain the clinical findings? Clinical findings based on ALL. Now see, this is a bone marrow. In the bone marrow, the neutrophils are formed from myeloblast. So this is the hematopoietic stem cell. This is a myeloblast. From the myeloblast, promyelocyte, myelocyte, metamyelocyte, band form. They are formed one by one. And then neutrophil is formed. So this is neutrophil and it comes in blood. Actually, what is happening here in ALL, what is happening? There is mutation in myeloblast. Itna mutation ho jayega, there is mutation inside this myeloblast and the DNA of this myeloblast that it uncontrolledly do mitosis. So it will replace the whole marrow. In the marrow, RBCs are also synthesized and platelets are also synthesized. But because of mutation in the myeloblast, only myeloblast will proliferate, no RBC will be formed, no platelet will be formed. So patient is anemic, that's why fatigue, pallor, and patient is thrombocytopenic, that's why epistaxis, bruisability, that's why bleeding, pateki. So okay, got it. Now this myeloblast proliferate too much and it will come in the blood. So the whole blood is flooded with myeloblast. That's why when you took up blood from the peripheral smear and see the slide, all of them are myeloblast. You can't see any other cell. You can see only myeloblast. This thing, okay, this is also got it. We also got this. Now this myeloblast from the blood will enter in the organs. They will enter in bones, various bones. They will enter in liver. They will enter in spleen. They will enter in various organs. So these myeloblasts from the blood, they are entering in various organs and causing enlargement of all organs. So patient have bone pain, patient have hepatosplenomegaly, patient has splenomegaly. Give me a thumbs up. It enters in testes also. It enters in brain, CNS also. So multiple organs are involved. That is the thing. Have you got it? This is lymphoma from the leukemia. Leukemia converted into lymphoma. Give me a thumbs up. Give me a thumbs up. So the patient is having lymphadenopathy, splenomegaly, bone pain. That is explained based on this. And what enzyme is expressed in this cell? What is the marker of lymphoblast? It is a lymphoblast, na? All of them are lymphoblast. What is the marker, enzyme marker for that? So TDT. Learn. TDT is a marker for lymphoblast. The full form of TDT is terminal deoxynucleotide transferase. TDT. Learn it out. What is the marker for myeloblast? Myeloblast, lymphoblast. The two blasts, the four leukemias. So in myeloblast, the marker is MPO, myeloperoxide, myeloperoxidase. In lymphoblast, the marker is TDT. Please learn it for your MCQs. Please, yeah, pass bhi hai. I got it. Pass bhi yahan pe bol sakte ho, you can say. So that is the thing. There are many markers, but one is main. Give me a thumbs up. Give me a thumbs up. Should I come on the next question? This is the next question. Easy one. I guess easy one. Everyone will be right here. Yes. So everyone will be right. So identify the cell. Identify the cell shown in the diagram. So most of you are right. You can see there is a cell, this big cell I'm talking about. This is the nucleus of the cell. Nucleus is normal, but something is abnormal in the cytoplasm. See the cytoplasm here. See the cytoplasm. Cytoplasm is looking like a wrinkled tissue paper. Wrinkled tissue paper. So it is typically seen in Gaucher disease. So it is a Gaucher cell. It is not RS cell. I have shown you the diagram of RS cell. It is owl-eye appearance, classical one. Classical, uske alawa popcorn tha, pleomorphic tha, lecunar tha. I have shown you the image of all RS cells. It is not anti-Ashkoff cell. Anti-Ashkoff cell, the nucleus is caterpillar shape. Caterpillar or owl-eye, single nucleoli. So these are the diagrams of anti-Ashkoff. It is not popcorn cell. Popcorn cell will have a nucleus like popcorn, looking like popcorn. So it is not popcorn cell, is a type of RS cell only. So it is not rest of the options. It is typically Gaucher. Hai na? So Shatanik, Khushi and Niveda are first to answer it correctly. Have you got it? So in Gaucher disease, we have typical crumpled tissue paper appearance. See the cytoplasm of the cell. This is a Gaucher cell. See here, see here, see here, see the cytoplasm. Don't see the nucleus, see the cytoplasm and compare it with a crumpled, wrinkled tissue paper. So typical appearance is known as crumpled tissue paper appearance. It is due to accumulation of glucocerebroside in the cytoplasm. This appearance is due to undigested glucocerebroside and it is an enlarged macrophage. This cell is a macrophage in which the cytoplasm contains undigested glucocerebroside, which is giving appearance of crumpled or wrinkled tissue paper to the cytoplasm. Done. RS cell, it is not there. It is seen in Hodgkin's lymphoma. Anti-Ashkoff cell is not there. It is seen in rheumatic fever. Popcorn cell is not there. Again, it is seen in nodular variant type of Hodgkin's lymphoma. So rest of the options are ruled out. Give me a thumbs up. It is a Gaucher cell. Everyone give me a thumbs up. Coming on the next question. The next question is in front of you. Very easy. Looking at the image, you will identify the abnormality. So what abnormality the patient is having? Does the patient is having IDA? Does the patient is having thalassemia? Does the patient is having acute leukemia? Does the patient is having Hodgkin's lymphoma? See the face of the facial expressions, the facial things on the face of the patient, and see the smear. In the smear, what it is shown. In the smear also very important findings are there. I will zoom it out to show you the smear. You can see the smear. In the smear, what I can see nucleated RBCs. These are nucleated RBCs. Can you see? This is a nucleated RBC. These are not lymphocytes. Huh? These all are nucleated RBCs. Apart from it, I can see target cell. This one is a target cell. So I can see few target cells also here. This one is also a target cell. So nucleated RBC. These all are nucleated RBCs. This is a lymphocyte. So you should identify, able to identify. So nucleated RBC along with target cell, along with this kind of picture. What it is? You all are right. Khushi, Manjusha, and Savita are first to answer it correctly. It is nothing else than thalassemia. Why in thalassemia? What is the abnormality in the face of the child? The cheekbones are more enlarged. The cheekbones are more enlarged as compared to usual. That's why child face is typical like this. Cheekbone and maxilla. These two cheekbones, that is this bone and maxilla here. These are enlarged. Maxilla only forms the cheekbone. It is enlarged. So can you see the abnormality? Give me a thumbs up. Why the bone is more enlarged? Why the bone is more enlarged? Where the RBCs are formed. Patient is having prominent cheekbones due to marrow expansion, and in the peripheral smear, we see nucleated RBC with target cells. So it is typical of thalassemia. Now I will explain you why there is prominent cheekbones, or why not only cheekbones. Skull bone is also prominent. It is not visible here, but skull bone is also prominent. So bones are more prominent on the face. So why? Where RBCs are formed? RBCs are formed inside the bone marrow. Inside bone marrow. So inside skull bone, this cheekbone, multiple bones ke andar RBCs are formed. In thalassemia, ineffective erythropoiesis is there. From hematopoietic stem cells, RBCs are formed, but when RBCs are coming in blood, they are destroyed. So blood is having less RBCs because patient is having thalassemia. It is a type of hemolytic anemia. So for compensating, bone marrow is doing abnormally more erythropoiesis. So the size of the bone marrow increases drastically to compensate because the peripheral blood chronically having less RBCs. So because to compensate those less RBCs, the bone marrow is trying to compensate it. That's why increasing the size of the bone marrow. So the bones become more prominent. In the bones in which erythropoiesis takes place, those bones will become more prominent. It is known as marrow expansion. It is a compensation. It is a type of compensation. So marrow expansion you can see here also in the skull bone. Compare it with normal. You can see here also. Can you see? This is marrow expansion. This is marrow expansion seen in the skull bone. This is marrow expansion seen in the cheekbones, in the maxilla bone. Can you see here also? It is maxilla. So this is typical facial expressions of a patient with thalassemia major or intermediate. It is not minor. So intermediate and especially major. This patient is having severe hemolytic anemia because of thalassemia, and bone marrow is compensating for that. Give me a thumbs up. And because of severe hemolytic anemia, the nucleated RBCs are also present in the blood. So both things are showing us it is hemolytic anemia. It is a type of hemolytic anemia, and severe hemolysis takes place in thalassemia major. Give me a thumbs up. Give me a thumbs up. In IDA, this is not the picture. In acute leukemia, there is no picture. Like facial expression itne typical nahi honge. These typical facial expression, dekhte se tum samajh jaoge. It is thalassemia. Everyone give me a thumbs up. I want thumbs up from everyone. This is the next question in front of you. I guess a easy question. I guess it is an easy question. It is an easy question. The following image shows what? The following image shows what? Which cell? Can you see the arrow? Can you see the arrow? So there is a nucleated, there is a cell. See the cytoplasm of the cell. Okay, I will zoom it out. So see the cytoplasm of the cell. Okay. So see the cytoplasm. It is showing hairy extensions. It is showing hairy extensions on the cytoplasm. So yes, it is a hairy cell leukemia showing hairy extensions. So Khushi, Manisha, and Shatanik, you all are right. So correct answer here is hairy cell leukemia. Hairy cell leukemia is an immature B cell which is having hairy projections on the surface. Can you see the hairy projections? This is a much better image. So this can come. It is a spotter. If it is coming in your exam, you have to mark hairy cell leukemia. You know what is hairy cell leukemia. I'm not going in the details. So next question. Look at the arrows. Look at the arrows. Look at the arrows. And tell me what the arrows are indicating here. This one. What the arrows are indicating here. Yes, who will tell me what the arrows are indicating? What is the correct answer? Is it a target cell? Is it a cystocyte? Is it a sickle cell? Or is it a spherocyte? Look at the arrows. There are two arrows. So most of you are right. Nibhash, Sweetie, and Mulai are first to answer it correctly. No, it is not sickle cell. Many of you have marked it as sickle cell. Okay, I will erase and show you the image again. It is cystocyte. The correct answer here is cystocyte. It is not sickle cell. Ye dekho. Arrow dekho. Look at the arrow. So arrow, look at the arrow. Sickle cell is like this. See, sickle cell is typically like this. And see this image and this image. This image and this image. It is not sickle cell. It is helmet shape. Triangle shape or helmet shape. It is not sickle. It is a helmet or triangle. It is cystocyte. It is not target cell. Target cell is this one. If this one is marked, this is a target cell. It is not target cell marked with the arrow. It is not spherocyte also. Done. Why? What is cystocyte? What is cystocyte? Who will tell me what is cystocyte? What is cystocyte? Cystocyte is a fragmented part of a RBC. Cystocyte is a word which is derived from a Greek letter cystocyte, which means divided. Which means divided. It is a fragmented RBC. It is irregularly shaped. There is no fixed shape of it. It is jagged with two pointed ends. Compare. These are the normal RBCs. These are fragmented, toote-foote RBCs. These are fragmented RBCs. So they have fragmented. They have pointed ends. Can you see the pointed ends? And they have irregular shape. They have irregular shape. These are known as cystocytes. These are typically seen in MAHA. What is MAHA? Microangiopathic hemolytic anemia. What is microangiopathic hemolytic anemia? So you know this is a blood vessel. In the blood vessel, the lining is endothelial lining. If this is a smooth lining, so whenever RBCs are traveling inside it, there is no harm, there is no damage to the RBC. Now imagine a blood vessel in which thrombus is formed. There is a thrombus formation. So here, just for say, there is thrombus formation here. So there is thrombus formation due to any reason. Due to the Virchow triads, thrombus formation is there. So whenever RBCs are traveling here, they will collide with the thrombus, they will get disrupted, they will get fragmented, and cystocytes are formed. And multiple cystocytes are formed. So this is known as microangiopathic hemolytic anemia. It is a type of hemolytic anemia. RBCs are getting destroyed. Give me a thumbs up. So that is known as MAHA, microangiopathic hemolytic anemia, and cystocytes is a feature of it. Give me a thumbs up. Now see at the image and tell me what it is. What it is, this cell and this cell. You tell me what it is. It is cystocyte. It is not sickle cell anemia. Those who have marked sickle cell anemia, please correct yourself. Done. So that is cystocytes. So I'm moving to that. So can you see the image? Various cystocytes are marked, circled. See all the cells which are circled. See shape of them. It is irregular. It is not fixed. It is not fixed. It is like this, something like this, something like this. So anything. They usually have pointed margins. Everyone give me a thumbs up. I want thumbs up from everyone. This is the next question in front of you. This is the next question in front of you. Identify the RBCs shown in the image. Most of the RBCs in the image are like with crenated margins. The margins are crenated. What such RBCs are known as with a crenated margins? You know the margins are crenated. Margins are only few of you are right. The correct answer here is echinocyte. So Murlidhar, Nivedha, and Mulai are first to answer it correctly. These are echinocytes with the crenated margins. All the RBCs. So you should know various shapes of the RBCs. The correct answer here is echinocytes. You know, with a spiculated margin, crenated or spiculated margin. Okay, see, these are the various shapes of RBCs you should know. You should know what is a spherocyte. It is sphere and there is no central pillar. It is completely red in color. So you should identify spherocyte. You should identify elliptocyte. It is egg shape. Elliptocyte. You should identify teardrop. So teardrop का दूसरा नाम है decrocyte. So teardrop तो easy है बोलना, but the other name of teardrop is decrocyte. You should identify cystocyte. Just now I taught you what is cystocyte. It is fragmented RBC, helmet shape with pointed margins. Done. You should identify echinocyte. See spiculated margins of the cell. Echinocyte and acanthocyte. Don't get confused between the two. Echinocyte have more spiculated margin multiple times, and acanthocyte have only 2 or 3 spiculations. So there is a difference between echinocyte and acanthocyte. Give me a thumbs up. This is a target cell. There is in the center, you can see a dot, and this is a stomatocyte. You can see a pillar, not at the center, but at the periphery. So you should know the various shapes and other forms of RBCs, not only identifying for them image-based question. You should be able to identify them. Not only this, you should identify the condition in which they are seen. Characteristic condition they are seen. Ye yaad karo, and they are also seen in other conditions. So you will be able to crack your MCQs 100%. Have you got it? So that is, spherocytes are characteristically seen in spherocytosis, but they are also seen in this, and this. Elliptocyte characteristically seen in elliptocytosis, but also seen in IDA, megaloblastic anemia. So you should learn this list. You should learn this list. So this is a list for you. Give me a thumbs up. For many IBQs or on the shapes of the RBCs, on all of these. So something is given from these, the same list. Some extra points are also there. So you should be able to identify target cell. See here, you should be able to identify bite cell. You know what is bite cell? This is a complete Someone has taken a bite of it from a cake, from a pastry. It is a circular pastry, and a bite is taken, so it will look like this. So this is known as bite cell. This is sickle cell. This is teardrop cell, dacrocyte. This is spur cell, acanthocyte. This is echinocyte. The other name of acanthocyte and echinocyte you should learn. Echinocyte also known as burr cell, which is our question, and acanthocyte also known as spur cell. Try to see the spiculations. In acanthocyte, the spiculations are more sharp and they are less in number. They are sharp but less in number. In echinocyte, the spiculations are more in number but they are less sharp. So number ज़्यादा है पर sharpness कम है. यहाँ पे number कम है पर sharpness ज़्यादा है. So looking at that, you should identify whether it is a acanthocyte or echinocyte. Other name of acanthocyte is spur cell and other name of echinocyte is burr cell. And you should know the conditions in which they are seen. You should know. Give me a thumbs up. Give me a thumbs up. I tried hard. You should know Rowlett's formation. You should know RBC agglutination. You should know and the conditions in which they are seen. Please learn this table and this table. You can expect an image-based question from these two tables together. Everyone give me a thumbs up. Now look at your question. Look at your question and identify. Look at your question. So you can see multiple RBCs. You can see spiculated or crenated margins. See the margins. They are spiculated. Spiculations are more in number, but they are less sharp. So these are echinocytes, also known as burr cells. So answer may echinocyte ho ya burr cell ho, one and the same thing. So the correct answer here is B. It is not cystocyte. Cystocyte is helmet shaped. It is not spherocyte. Spherocytes are circle with no central pillar. It is completely red looking. It is not acanthocyte. Acanthocyte is having less spiculations but more sharp. Acanthocyte is also known as spur cell. So spur and burr. Everyone give me a thumbs up. Everyone. And question can be on the conditions in which they are seen. Identify करना तो बहुत easy है. That is a baby question जो मैंने दिया था. ज़्यादा अच्छा, a higher difficulty level question will be there if I give you the cell, any cell among them, and ask you in which condition it is seen. So you should know the conditions also in which they are seen for higher level question. अगर easy level का बनाना होगा तो they will give you the image and say identify it. And difficult level का question बनाना होगा तो they will give you the same image and tell you the condition in which it is seen. So you should know both columns in this table. Everyone give me a thumbs up if you got me. If you got me. So the correct answer here is echinocyte. That is B is the correct answer here. Coming on the next question. Next question is in front of you. Okay. Easy one. Easy one. So a 6-year-old boy is there with acute abdominal pain and a non-healing ulcer on the medial malleolus. Peripheral smear is shown. What is the condition? What is the problem in the condition? In the peripheral smear, what you can see? In the peripheral smear, okay, I will mark it for you. You can see some RBCs in this shape. Some RBCs in this shape. So what is the typical condition? Yes, it is typical sickle cell anemia. Because of sickling crisis, the patient is having acute abdominal pain and non-healing ulcer because of the sickling crisis. You know what is sickling crisis. So what is the abnormality here in sickle cell anemia? So Nibhash, Savita and Sahana are first to answer it correctly. It is single amino acid ka substitution. Name the amino acid. Who will name that amino acid which is substitution? So actually, okay, I will tell you what is happening in sickle cell anemia. This is RBC. This is RBC, normal RBC. Normal RBC is biconcave. The periphery 2/3 contain hemoglobin. It is red color hemoglobin. And the central 1/3 doesn't contain anything. It is known as pellar. It is known as pellar. There is no nucleus in RBC. And periphery contains hemoglobin. Hemoglobin at the periphery is made up of two things. Heme and globin. Hemoglobin is made up of two things. Heme and globin. Globin have two chains, actually four chains, 2 alpha chains and 2 beta chains. So these alpha and beta are proteins which combine together to form the globin. So proteins are formed from the genes. So genes are not present in this RBC, but the precursor of this RBC, that is normoblast. Normoblast is the precursor of RBC that have nucleus. Inside the nucleus, DNA is present. Inside the DNA, genes are present. So the genes which is responsible, there are some genes which are responsible for alpha globulin formation. There are some genes which are responsible for beta globulin formation. I am interested for beta. So beta ka jo gene hai, that is present on the DNA, that gene have a codon. All genes have a codon. Now the triplet of the codon that will form one codon stands for one amino acid. We know it. Yes or no? So what is happening normally? Normally beta globin may sixth codon, number 6 codon. You know, this is the mRNA. This is codon number 1. This is codon number 2. This is codon number 3. Codon number 4. Codon number 5. This is for beta globin. I'm not talking about alpha. Beta globin of the hemoglobin. Beta globin of the hemoglobin. So the 6th codon, normally the 6th codon is GAG. and it codes for glutamic acid. If you see in biochemistry, GAG stands for glutamic acid. Glutamic acid. Because of mutation, now mutation is taking place. Mutation is, instead of GAG, it becomes GTG. Instead of GAG, it becomes GTG. And GTG stands for valine. GTG stands for valine. So learn both questions. Learn both questions. In some exams, the examiner will ask you कि mRNA पे क्या change हुआ? तो mRNA पे GAG से GTG हो गया. और अमीनो एसिड में क्या चेंज हुआ? तो ग्लूटामिक एसिड से वलाइन हो गया. So because of which abnormal beta globulin is formed. It is the 6th number codon. ये भी learn करो. Abnormal beta globulin is formed. So this hemoglobin will become abnormal. Now this is the RBC. Normally hemoglobin is present at the periphery. So this abnormal hemoglobin, which is having abnormal beta chain, heme is normal, globin is abnormal. Globin may be alpha is normal, beta is abnormal. When it will come at the periphery, it will change the shape of the RBC and it will precipitate. Because of which the RBC will change the shape, it will become sickle shape. From circular, it will become sickle shape. That is the problem. It will become sickle shape. Have you got it? Sahana is asking to explain again. So Sahana, in the beta chain, amino acid of the beta chain, the 6th codon is abnormal. So this is the 6th codon. Normally 6th codon is GAG. Because of mutation, it becomes GTG. So adenine replaced with thymidine. So that is the problem. So GAG stands for glutamic acid. GTG stands for valine. So instead of glutamic acid, यहाँ पे valine आ गया. 6th position amino acid. So 6th position पे GAG की जगह GTG आ गया. A की जगह G आ गया, glutamic acid की जगह valine आ गया. So that is the problem. So this will become abnormal. और इस abnormality की वजह से shape of RBC is changed. Now this is a blood vessel. This is a blood vessel. When circular RBCs were moving from it, there was no problem. They were all moving. Now this is another blood vessel. When the RBC becomes sickle shaped because of abnormality in the beta globulin of hemoglobin, when they become sickle shaped, all of them combine together, they clump together, and they will do the occlusion. So this is known as crisis. This is known as sickle cell crisis. So this organ is not getting blood because there is an obstruction of the sickle cell. They compile together. They form rowlets. They compile together and blood cannot move. So the organ will have severe pain and ischemia. Give me a thumbs up. That is a summary. That is a summary of sickle cell in short. I'm not teaching you sickle cell anemia in detail. Have you got it? So the same thing is shown here. See here, everyone see here. It is beta globulin gene. At the 6th codon, GAG की जगह GTG है, glutamic acid की जगह valine है, तो circular RBC की जगह sickle shaped RBC, and this sickle shape will do the clumping. Everyone give me a thumbs up. Everyone give me a thumbs up. Now read your question. What the image is showing? Image is showing a sickle cell anemia. Can you see the image? Let me zoom it out. You all can see the image is showing sickle cell RBCs. So sickle cell RBCs में what is the abnormality? You tell me it is a trinucleotide repeat? No. It is an antibody to RBC? No. It will occur in autoimmune hemolytic anemia. Is a genomic imprinting? No. It is substitution of single amino acid base. What is that amino acid? Name it. Name it. It is valine instead of glutamic acid. It should be glutamic acid normally, but because of mutation, it is valine. That is substitution of single amino acid. Give me a thumbs up. So learn the name of codon also. Codon abnormality. Normal codon is GAG. In mutation, it becomes GTG. Learn the name of amino acid also. GAG codes for glutamic acid. GTG codes for valine. So instead of GAG, there is GTG due to mutation. Instead of glutamic acid, there is valine due to mutation. And instead of circular shape, it will become sickle shape because of mutation. Give me a thumbs up. And sickle cell accumulate. So sickle cell में problem क्या है? They accumulate together and form the clumps and they cause the crisis. Give me a thumbs up. That is the summary in short. I tried my best to explain the concepts in shorter time. So that is the thing. So questions can be asked on anything. So this time question is on amino acid substitution. Question can be specific for the name of the codon. Question can be specific for the name of the amino acid. उल्टा option भी आता है, valine to glutamic acid. No, it is glutamic acid to valine. Normal is glutamic acid. Because of mutation, it becomes valine. So उल्टा option भी मिलेगा. Give me a thumbs up. You got it? Give me a thumbs up. Should I come on the next question? So here the answer is C. This is the next question in front of you. You have to write your answer in the chat box. See the question. See the question. What is the diagnosis? The question in the question now, read options first. What I have asked, what is the diagnosis? And what hemoglobin electrophoresis will show? Two questions I have asked. So see the image. See the image. Now you can read the question. After developing mild diarrhea after a diarrheal illness, a 9-year-old child presents sudden severe extremely pain. Extremely pain. So patient is having extreme abdominal pain and he is having enlarged spleen also. She is severely anemic, 6.6 hemoglobin. You can see all the RBCs, most of the RBCs are sickle shaped. Most of the RBCs are sickle shaped. So my diagnosis is sickle cell anemia. Here normal hemoglobin nahi hoga. Normal hemoglobin is hemoglobin A, but here hemoglobin is RBC is circular. Here hemoglobin S will be there, in which beta globulin is abnormal, alpha is normal. So beta globin may problem hai. So hemoglobin electrophoresis mein you will get hemoglobin S. Why the patient is having pain? Because of crisis. Because of sickle crisis, the RBCs will accumulate together and they will obstruct the blood flow. And what biliary tract complication this patient can have? So all these sickle cell RBCs, normal RBCs die in 120 days. This sickle cell RBCs die in less than 120 days. Spleen will destroy them because they are abnormal. So spleen will destroy them. So when this RBC is destroyed, the hemoglobin will come out. Heme and globin will be separate, and heme, excessive heme in the blood will form stones. It will form stones in the gallbladder. So gallbladder pigmented stones is a complication. Give me a thumbs up. So everything is related. Huh? It is very easy. So the diagnosis is sickle cell anemia. On hemoglobin electrophoresis, you will find hemoglobin S. Patient have hemoglobin S. Patient को sickle cell crisis की वजह से severe pain है, and patient will have biliary stones because of excessive destruction of the RBCs by the spleen. Give me a thumbs up. So all the heme coming in the blood will form the stone. Give me a thumbs up. So coming on the next question. Next question is in front of you. Identify the cell. Be fast, huh? In which condition it is seen, this cell. First identify what it is, then write in which condition it is seen. Identify the cell. What cell it is. You can see a beautiful cell. Something is present in the cytoplasm of the cell. So what it is? What it is? Name the cell. So only one of you is right. Oh, strange. So Vijay and someone else is, I can't see the name of the second person. So why? The condition here is plasmacytoma. It is a Mott cell. It is a Mott cell. What is Mott cell? It is typical diagram of Mott cell. Even a blind person can identify it. Why you have not identified? I'm very angry. Huh? Why you have not identified? It is a Mott cell. No, it is very easy. It is multiple myeloma. Multiple myeloma, Richard. It is not given in the option. Savita, you should go for plasmacytoma. No? Plasmacytoma, multiple myeloma, all of them are plasma cell dyscrasia. So the classification of plasma cell dyscrasia. So plasmacytoma is one of the plasma cell dyscrasia like multiple myeloma only. So you should go, if multiple myeloma is there in the option, okay, I'm also happy. But if it is not there, you cannot leave the question. So you should go for plasmacytoma. Why you have not gone for plasmacytoma? So it is also plasma cell dyscrasia. So Mott cell is seen in all plasma cell dyscrasias. What is a Mott cell? It is a Mott cell. What is a Mott cell? In the Mott cell, you see multiple Russell bodies. What are Russell bodies? It is the, immunoglobulin. There are 2 light chains and 2 heavy chains in an immunoglobulin. So because of abnormality or mutation, patient is synthesizing only light chain. Heavy chain is not synthesized. So this is abnormal immunoglobulin. Immunoglobulin is there, but it is abnormal because it contains only light chain. It doesn't contain heavy chain. So this light chain, it is formed inside the plasma cell. Inside the plasma cell. So this light chain will accumulate inside the plasma cell because heavy chain is absent, and they will form Russell bodies and they will be seen as infusions inside it. These are all light chains which are seen accumulated inside the plasma cell. So this cell is a plasma cell inside which normally immunoglobulin is formed, but here heavy chain is absent. Only light chain are present. So multiple light chain combined together and they are forming aggregates. Can you see the aggregates? These all are aggregates. And this abnormal plasma cell, which contains multiple aggregates of light chain in the cytoplasm, such abnormal plasma cell is known as Mott cell. And it is seen in all plasma cell dyscrasias. Give me a thumbs up, everyone. Everyone, fatapat thumbs up dete jao, huh? So correct answer here is Mott cell. This is the next question in front of you. I guess easy one. It is the easy one. Everyone will be right. Typical feature is shown in the image. Typical feature is shown in the image. Fast. A 45-year-old person is there. 45-year having, patient is having paresthesia in the hands and feet and spastic weakness. So patient is having neuropathy. That is loss of sensation. Paresthesia means loss of sensation. Loss of sensation. Patient can't feel the sensations. Paresthesia in the hand and the feet. Number 1. Babinski is absent. Ankle jerk is absent and Babinski is noted. Babinski is present but ankle jerk is absent. From the reflexes, ankle jerk is absent. And peripheral smear is shown here. So what it is, so most of you are right. It is a megaloblastic anemia. No? It is a macrocytic anemia. Typically, you can see a neutrophil here. Count the lobes in the neutrophil. It is lobe 1, lobe 2, lobe 3, lobe 4, lobe 5, lobe 6, lobe 7. I can count 7 lobes in a neutrophil. It is a hyper segmented neutrophil. It is a hypersegmented neutrophil. So hypersegmented neutrophil is a neutrophil having more than 5 lobes in the neutrophil. Normal neutrophils have less than 5 lobes in it. If any neutrophil having more than 5 lobes in the nucleus, it is macrocytic anemia. It is number 1 clue. Number 2 clue, see the RBCs. See the size of the RBCs. This RBC, this RBC, this RBC. So these are megalocytes. Although for comparison, lymphocyte is not given here. But grossly, I can see the size of the RBC is more as compared to normal. So 2 clues given in the question. The size of the RBC is more. It is macrocyte and hypersegmented neutrophil. So it is nothing. And the third clue in the question, the patient is having paresthesia. Patient is having loss of sensation. That is peripheral neuropathy. Patient is having neuropathy. So it is nothing else than macrocytic. Macrocytic may be megaloblastic. Megaloblastic may be दो reason होते हैं, folate और vitamin B12. It is vitamin B12 deficiency. It is not folate. अगर question में loss of sensation नहीं होता, तो image is fitting for both. Folic acid में भी यही होगा, vitamin B12 deficiency में भी image यही होगा. लेकिन loss of sensation occurs only in vitamin B12, not in folic acid. So Manjusha, Murlidhar and Dr. Gaurav are first to answer it correctly. It is a macrocytic anemia. Have you got it? The clue in the question is hypersegmented neutrophil. Hypersegmented neutrophil typically seen in megaloblastic or macrocytic anemia. Give me a thumbs up. You know why it happens? Why it happens, you know now. So in short, okay, in just half minute, I will tell you. This is the bone marrow. In the bone marrow, this is the precursor for RBC. This is hematopoietic stem cell. These are normoblasts, early normoblasts, intermediate normoblasts, late normoblasts. Ultimately, reticulocyte and RBC are formed, and these RBC will come in the blood. That will happen normally. So all the precursors have nucleus. RBC do not have nucleus, but the precursor of RBC have nucleus. Nucleus is made up of 4 things: adenine, guanine, cytosine, and thymidine. For the synthesis of thymidine, thymidine is synthesized from uracil, and for this conversion, we require vitamin B12 and we require folic acid. If any of them is deficient, vitamin B12 is deficient or folic acid is deficient, thymidine will not be synthesized. Thymidine will not be synthesized, so DNA will not be synthesized. DNA will not be synthesized, so the precursors do not contain DNA. But cytoplasm is okay, hemoglobin is okay, but nucleus is not there. So the RBC which is formed here is abnormal. So it is abnormal. Such RBC is known as macrocyte, and the anemia is known as megaloblastic anemia. Such RBCs are larger in size because cytoplasm is okay, hemoglobin is abundant, but nucleus is defective. Give me a thumbs up. That is the problem here in megaloblastic anemia. Now it occurs due to deficiency of both vitamin B12 and folic acid. Apart from it, there is one additional function of vitamin B12. You know, nerves. Humans have nerves. Nerves have a myelin sheath on it. Nerves has a myelin covering on it. Axons have. So these are the axons. The myelin sheath. There is a protein inside it which is made for the synthesis of myelin sheath. Vitamin B12 is required. So if vitamin B12 deficiency is there, vitamin B12 deficiency, so anemia to hoga hi hoga. Macrocytic megaloblastic anemia to hoga hi hoga. Myelin sheath will not be synthesized, so patient will have neuropathy. So patient will have peripheral neuropathy also. So loss of sensation will be a feature typically of vitamin B12 deficiency, not of folic acid. So folic acid deficiency है तो सिर्फ anemia होगा. Vitamin B12 deficiency है तो anemia के साथ साथ peripheral neuropathy भी होगा. हमारे patient में दोनों था. In our patient, this is anemia, I can see, and here I can see peripheral neuropathy because loss of ankle jerk is there and paresthesia is there. Everyone, give me a thumbs up. I tried hard. I really tried hard. So in 1 MCQ, I'm covering more than 10 MCQs, you know, actually, by giving you such knowledge. So that is the thing. This is the next question in front of you. Again, an easy one. Easy one. Spot the diagnosis. See these RBCs. These 2 RBCs are abnormal. So what they are showing. Spot the diagnosis. What they are showing. Most of you are right. Mohat, Richard, and Murlidhar are first to answer it correctly. It is showing basophilic stripling. Can you see the dot inside it? It is basophilic stripling. It is basophilic stripling, and basophilic stripling typically seen in lead poisoning. So correct answer here is A. So what it is? It is basophilic stripling. So what is beta? My 3 questions to you. What is basophilic stripling? What are the why it happens? What, why, and what are the other conditions apart from lead poisoning in which basophilic stripling is seen? Who will tell me? It is lead poisoning because basophilic stripling is there. This is typically basophilic stripling. Basophilic stripling of the RBCs. These are the causes of basophilic stripling. I have a mnemonic for you. Lunatic. The mnemonic is lunatic. L is lead poisoning. U is unstable hemoglobin. Unstable hemoglobin. N ये यहाँ पे इसको अगली लाइन में ले लो. N is nucleosidase deficiency. A is anemia due to B12 deficiency. A. T is thalassemia. I is infection, and C is cirrhosis. Say the full form of lunatic. So lead deficiency is one of the cause of basophilic stripling. It is looking like dot, 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 dot. Yes, thalassemia is there. No, sideroblastic anemia is not there. Dr. Tariq, in sideroblastic anemia, we do not find basophilic stripling. Yes, thalassemia is right, Savita. So these are all causes in front of you, not only one. All the causes are written here. Give me a thumbs up. Everyone give me a thumbs up. So these are the causes of basophilic stripling, you know. So much more questions are ahead. Okay, so this is the next question in front of you. Okay, so I have to end this link because 1 hour is over. Don't worry. So I will continue from this question only. Total 100 questions are to be done. Let me count abhi tak kitne hue hain. 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16. Till now 18 questions are done only. I guess 30 ho jate first hour mein. 18 questions are done. So I will be a little bit faster in the next 2 hours. I will try to cover all 100 today. So I'm in my PPT, all 100 images are given. So it is 100 IBQ marathon. I will continue just after 10 minutes at 10:15 sharp. 10:15 sharp. Join episode number 2 of this IBQ 100 marathon. So IBQ marathon का episode number 2 join कीजिए just after 10 minutes. There is a break for 10 minutes. Have your tea, have your coffee, refresh yourself, come back. We will do practice again. And we will complete all 100 today only. I am ending this link. It is expiring. Okay, thank you.